उनका है ना हाँ so we yes so it's on the recent changes in NAAC assessment for Health Sciences University, and the speaker is Dr. P. Vataslaswamy. I'll request Dr. Punita Manik to chair this session.
Ma'am is joined. Good evening, everyone. So nice to listen to all of you. Ma'am is joined.
Am I audible, Dr. Purita?
Good evening, ma'am. Welcome.
Good evening.
Yes,
Good
yes,
evening.
you are very much audible, ma'am. Oh. It is my proud privilege to introduce Dr. P. Vataslaswamy, who is currently serving as Director IQAC at Dr. D.Y. Patil. She is also the Director Academics at the same institute. And she is an anatomist and has spent almost 34 years in Armed Force Medical College and has retired and has been the Dean at D.Y. Patil Medical College, Hospital Research at Pune. She has to her credit various awards, to name a few. She's a Fellow of Anatomical Society of India, Fellow of International Medical Sciences Academy. She has received Best Teachers Award at Dr. D.Y. Patil University, Best Teacher Award at Grabs Educational Trust, and has received Lifetime Achievement Award at Society of Clinical Anatomists in 2024. She has more than 75 publications in national and international journals. She's the author of Histology Viva, contributed chapters in over 8 books, and has been the resource person in medical education, contributing to books published by AFMC and D.Y. Patil. She has been the member of so many societies, and she has contributed to the community service. She is a trustee and treasurer of Care India Medical Society, which is an NGO for terminally ill cancer patients. We welcome you, ma'am, and we are anxiously waiting to listen to your words on recent changes in the NAAC assessment for health sciences universities. Welcome, ma'am.
Thank you. May I share the slides? Good morning from Virginia, and good evening to all of you. I know that it is the last but one, as mentioned just now, but I've been listening to the previous speakers, previous sessions, and I'm sure that it is about quality, but quality. So coming to the topic, which is the last of the sessions today, I must tell you that the changes in the NAAC assessment for health science universities have been changing for the past decade. And we were initially with only the qualitative assessment, but all of you know that it is very essential and imperative for any university or educational institution to continuously grow and evolve. And it is a continuous process with the intention to bring in uniformity and also promote quality. Without quality, we cannot, like just now I was listening to Dr. Pawan Kumar, and we cannot really see to it that we grow and evolve without the quality. Keeping in sync with this, the National Assessment and Accreditation Council, NAAC, has come up with a methodology and a manual for health science universities in 2019. And at that time, they had a pilot study. Many universities have participated in that pilot study for coming up with this new methodology at that time. And Dr. D.Y. Patil Vidyapeeth, our IQAC, we were part of that pilot study. And at that time, changes were made as per UGC Core Empowered Committee. And this is required because before we go in for the recent changes, we should know what were the changes that were thought about earlier. And InflipNet was empowered to do the authentication and provide data to NAAC, NIRF, and MBA. And accordingly, changes were made in the data. Further changes were made after getting feedback from DVV partners, data validation and verification partners, and also in consultation with ICT. And this is only to ensure that quality assurance is integral part of functioning of any higher education institutions. Considering that the universities have dynamic environment, NAAC has come up with 5 core values. Most of you must be knowing it. This is to ascertain credibility and validity. So before going in for any accreditation, we have to keep in mind these core values. One is contributing to national development, fostering global competencies among students, inculcating value system among students, promoting use of technology, and quest for excellence. Quest for excellence continues forever. The changes that were is a paradigm shift from qualitative to quantitative. Initially, the team was visiting the institutions and universities, and then the assessment was done. Then it was shifted from qualitative to quantitative, which was more ICT enabled, objective, transparent, scalable, and robust. So a quality indicator framework was constituted or was decided with what you all know, with 7 criteria in mind. The 7 criteria are the ones which form the firm foundation for the NAAC accreditation. Key indicators are there under each criterion, and there are metrics to elicit response from higher education institutions. And these metrics are qualitative are about 30% and quantitative 70%, with a total weightage of 1,000. This is what is being followed so far. That is the NAAC grading. When we come to cumulative grade point average, everyone, every university, every institution, we talk about, like just now I was listening to enhancing visibility, enhancing quality. So the moment you know that when you talk about an institution and university, what is their CGPA? Out of maximum of 4, we know that A++ are the institutions which are between 3.5 to 4. And the difference between A and A++, A plus and A++ is that the validity. Usually the validity is 5 years, but for those universities or institutions that get A++, validity is for 7 years. And later, after the 3rd cycle, when you get this A++ and the validity is 7 years, it all depends on the timely submission of annual quality assurance reports. That is itself, after 7 years, becomes self-study report, that is SSR. Our university, Dr. D.Y. Patil Vidyapeeth, is A++ with a CGPA of 3.64. And the grading system is like this, which you all know. Once again, to reiterate the same thing, A++ is 3.51 to 4. And the lowest is C. C is the one till the credited institutions, 1.51 to 2. But the ones which are not accredited are under the category of D, that is less than 1.5. So we must focus on these 3. B, 2 to 2.5, C, 1.5 to 2, and less than 1.5, which are the institutions not accredited. Because in the reforms, that the recent reforms, we must focus on these institutions so that more and more institutions and more universities come forward for accreditation. Otherwise, when you take the data of NAAC, you will find that there are about more than 30,000 plus institutions that are yet to be accredited. Similarly, there are about 65% universities are yet to be accredited. So with the view to see to it that there are more universities and more institutions participating in accreditation to have a quality check, to see to it that there is enhancement of quality, NAAC has come up with a proposed binary accreditation process. This is announced in June 2024. To see to it that all the universities and all the institutions, both autonomous and affiliated colleges, NAAC has organized workshops in all the regions to sensitize the health universities. There was a press release in the month of January 2024. And these workshops have been conducted to see to it that all the vice chancellors, directors, and the faculty who are concerned all attend these workshops. This is with the aim to transform higher education system implementation of as per NEP 2020. what is the outcome or what is the target, what is the goal. When we see to the goal of National Assessment and Accreditation Council, this is with the intention to see to it that 50% of the universities, they can compete, or they will compete, they will be able to compete with the best of the world. Now, how do we achieve it? Now we must know higher levels of quality depend on teaching learning process, which is very important. Research and innovation is a very important criterion as far as the existing one in criterion 3. Then the faculty. Just now I heard we have to start with motivating faculty. Once you motivate the senior, that is faculty, then it percolates down to everyone, and then you can achieve what you want to achieve. Then the skills. Now we are giving a lot of importance to the skills, how to upskill, how to reskill, how to see that there is skill development, that is enhancing employability skills. See to it that how they help the ones who undergo the skill development techniques. Academic ambience, very important. Then commitment to sustainability. Just now I heard sustainability is the one which is very important. Now we talk about sustainability, we talk about SDGs. So you must remember that. And all this become an integral part of the accreditation of higher education institutions. Now to see to it that we become part of this, there was a necessity to set new reforms. That is what we are going to talk about. What are the recent changes in the NAAC reforms? To set the new reforms, a committee was constituted by Ministry of Education, Government of India, Dr. Radhakrishnan Committee. In the year 2022, Dr. Radhakrishnan was the chairman of ISRO. Under his able chairmanship, a committee was constituted, and the committee prepared a preliminary report that was placed on website, inviting suggestions and feedback. Many universities, many institutions have suggested many points, and that was taken into consideration, and ultimately a final report was prepared, and that was accepted in January 2024. And this report is consistent with the vision NEP 2020. And you must remember, now we are all technology driven. So this is a robust technology driven modern system with minimal manual involvement. And I must say almost zero manual involvement we should think of. And this is to ensure transparency and integrate inputs from the stakeholders. Now, what were the objectives of these reforms? Now we know that, as I keep on saying, that in our own hand, that 5 fingers are not the same. Similarly, in our country, we know that there is a lot of heterogeneity, and we need to categorize them depending upon their vision and legacy. And we need to know, because many institutions, as I mentioned, 35,000 plus institutions are yet to be accredited. So keeping that in view, why the institutions are not coming forward, why the universities are not coming forward, that is, we can understand what is the inhibition and why they are not coming forward, and how to go about it, and how to look at it, and how to resolve the issue. With that, there was a special focus on rural and remote locations. And these institutions require mentoring and hand-holding, and all this is to achieve one nation and one data platform. And this is capturing data from the higher education institutions with an inbuilt design for collateral cross-checking and including the stakeholder validation. That is really important. Now, what are the recommendations of this Radhakrishnan Committee? The first one is no grades. Just now I talked about grades. That grading system was there till now. Now, in this system of binary accreditation, no grades. And it is to have a quality check to see that there is quality culture that is created in the higher education institutions. So in the first stage, it is a binary accreditation. The decision taken was accredited or not accredited. This is being followed in many leading countries. So the decision that was taken is accredited or not accredited. And here the grading is not there, but I'm just telling you, earlier I was talking about the grades that are there existing now. So the accredited, not accredited, the thought has come of the institutions which are on the borderline, that is to be mentioned as, or to be taken as provisionally accredited. And in this system, which is the recent change that has been given by the committee, there are 10 attributes compared to the existing one where there are 7 criteria. There are 10 criteria, which are the attributes that depend upon inputs, processes, and outcome. Now, earlier we used to focus on inputs and processes, and any activity we used to keep telling that you should know what is the activity and what is the process involved. But please remember, outcome is equally important. So the criteria, 10 attributes that are being now recommended are by the way of inputs, processes, and outcome. The attributes from 1 to 4 are the ones which depend on the inputs. Attributes 5 to 7 on processes. And attributes 8 to 10 are on the outcome. Now, if you take the weightage of all these 10 attributes, the criteria that is of inputs 1 to 4, if you take of weightage of 1,000, it comes to about 250. And the rest, the processes and outcome, they contribute to almost 750. So we must bear in mind when we are preparing, when you are thinking of going ahead with the recent reforms, what is that we must focus on, and what is that is going to help us to see that we can aspire or we can get the accreditation what we are aspiring for. So that is the first one, that is binary accreditation. The second stage, that is stage 2, is maturity-based graded accreditation, MBGA. And here it is not grade, no grades. Levels are given, levels 1 to 5. And these levels 1 to 5 are the ones to see to it there is continuous improvement. So the lowest is level 1 and highest in that is level 4. And these institutions that fall under these levels, level 1 to level 4, are the institutions of national excellence. And what are the institutions that will go ahead with level 5? Now, level 5, those who are given the status of level 5 are the institutions of global excellence for multidisciplinary research and education. So to come to this level, you must know that there is a lot of the attributes that are given to be thought of, to be attended to, and to be planned. And this is to encourage accredited institutions to raise the bar from level 1 to level 4. And once you achieve level 4, and then think of the criteria or the metrics that are required to go to level 5, that is institutions of global excellence for multidisciplinary research and education. All this is with the intention, with the thought to see to it that this is to enable to improve quality and see to it that many of our universities, they become part of top global institutions. Now, as I mentioned, the metrics depend on processes and outcomes that impact across different attributes of higher education institutions. And these new reforms changes to be implemented by December 2024. And there was a workshop recently in the Eastern region, Utkal University, in which Chairman of Executive Committee of NAAC, Shri Anil Sahasrabudhe was there, who mentioned about this binary accreditation and who said that they will be implemented by September 2024. And there will be 2 manuals that will be prepared. One manual for the universities and one manual for the colleges, institutions. And the date that is given for the binary accreditation was till June. And before June, the institutions that have applied, that have submitted IIQA, submitted SSR and DVV, an option is given. The option is to continue with the current procedure, that is with the 7 criteria which I mentioned just now, and grading, or to go ahead with the new reforms, that is binary accreditation, and then followed by the maturity-based one. And all this is thought about to see to it that it is system-friendly, smooth, and easy, and it makes all our jobs easier. Just to have a comparison, what was current one, I use the term old, and the recent changes, new reforms. I've already mentioned 7 criteria in the current one and 10 attributes and criteria in the recent one that has been recommended. Now, if you ask me what are the differences, I must tell you that the 7 has become 10, but with the intention that more data, more details are sought from the universities and the colleges, and the changes or the data that are being asked or required, once we go through about each of them under each criteria, then you know exactly what is expected of us. So it is 7 and 10 on the other side. And the last one in the new reforms is the sustainability outcomes, that is green initiatives. So you must know what you should do to see to it that you acquire maximum in this sustainability outcomes. Then there is one for some of the uniqueness and situatedness. Now, if you see when the manual comes up, the criteria, the percentage of criteria for this, it is discipline specific. So we will know what is applicable to us depending upon we are talking about health universities, we are talking about medical colleges. Similarly, the other disciplines like pharmacy and others, management, that it will differ and it will be dealt with later once we get the manual, which is under process. I mentioned that in the current one, cumulative grade point average, I am not going again into those details. Only thing, please remember that those institutions who have gone ahead and got the grade and they are going ahead with the annual quality assurance report, please remember it's to be timely submitted and it becomes SSR as I mentioned. And after they complete, they can decide to go ahead with maturity-based assessment later. Or if they want to, I am told that you can go ahead in between and then you will follow the new reforms. In new reforms, as I mentioned, no grades as per CGPA, etc. Accredited and not accredited. Remember only these two, accredited or not accredited. And eligibility is the first batch to pass out. Earlier they were saying 2 batches to pass out. This needs clarification. And the accredited ones can, after 2 years, can go ahead with the maturity-based one to stage 2. And the provisionally accredited ones have to reapply after 1 year. This I've already mentioned, what is qualitative and quantitative metrics and what is the total weightage. And I mentioned about the new ones, criteria 1 to 4, I'm sorry, inputs, 5 to 7, processes, 8 to 10, the outcomes. The difference between the two, quantitative I'm talking about, qualitative I'm talking about, the word limit for qualitative was 500 in the old reforms, many of the qualitative ones. But in the new reforms, qualitative metrics word limit has been increased to 1,000 to 1,500. Now, what is the difference? There is always a peer team visit in the current one. For the qualitative metrics, that is the 30% one, which is physical. Whereas now in the new reforms, peer team visit may or may not be. It all depends on you. When you submit the data, foolproof, nothing to worry about. But if there is any incorrect data, any forging of the data, any fake document, they may decide to visit, but the visit is online. So it is may or may not. So I always keep telling that when you are going for accreditation, first just now I was listening to that internal, like internal audit, internal accreditation by a team is very essential to see to it where you stand. Once you do that, you're confident that you can go ahead and then achieve the accreditation what you want. So that is very, very important, that see to it that you do it. Now coming to this manual that we received, it is on the website of NAAC Reforms 2024 regarding binary accreditation. This is a stakeholder consultation for the universities. These are the attributes that I talked about just now. You can see the attribute is given, input or process, and that is been specified definitely. And the last one is for some universities, the uniqueness is required, situatedness is to be added, that comes under both process and outcome. So more details we'll know once we get the manual. Now the first one, when you think of the first attribute, when you see, I'm not going into the details, you can see it is there on the website. I want to tell you that the metrics in the first one, when you see the first attribute is curriculum design, in that there are about 8 of them. The second one is faculty resources, 6 are there. And the third is about infrastructure. The infrastructure, there are about 6 attributes, there are 6 metrics that are given. All these 3, what I mentioned just now, they come under inputs. So I told you, you have to focus more on the processes, more on the outcome. Yes, inputs also are required, 250, about 250 weightage, but the rest is maximum is for processes and output. So please remember that when you are working, I'll come to that point little later, but we are at financial resources. That is the third one. Third objective is that is over. I will come to the fourth one, financial resource and management. There are about 6 metrics in that. You can go through those metrics later. The learning and teaching, which is the 5th one, the metrics are about 7 in number. Governance, the extended curricular, that is process 6, that is 6-1, extended curricular engagements. This is again, once again, there are 6 metrics. Then we come to process 7, that is attribute 7, governance administration, very, very important. This all depends upon the vision and mission of the university and of the institution. So you must see to it that you fulfill all what you have committed in the vision and mission of the institutions. And coming to the next one, this is about 8 metrics in the 7th attribute. 8 is student outcomes. Just now we were talking about enhancing our visibility. So please remember that there is so much that you can talk about student outcomes. Now student outcomes, when you see there are about 8 metrics in that student outcomes, then the most important is research. I heard just now about innovation and research and innovation outcomes, which are there, which are constituting about 8 metrics. Please go through each and every one. See how best you can see and enhance your own institution's research activities and innovation outcomes. And last is the 10th one, sustainability, green initiatives. And under this, community activities, waste and water management, and green audits, collaboration with the NGOs, and progressing towards net zero, all these are given. So you must go through this. And before I say thank you, I must tell you that there is a to sum up what we have done just now. I want to give a little brief about what is expected of us. Now, to conclude, I must say that universities and autonomous colleges and affiliated colleges all should come under the purview of accreditation. Binary accreditation is the one that has been constituted after the recommendation of Radhakrishnan Committee. This has less cycle time, lower accreditation fees, having 10 attributes, which have been detailed in the regional workshops that have been conducted. And we have attended in the month of March in the Western region. And coming to what should you do, I always say that please do little reverse engineering. You must do that so that you know where you stand, and you go through the draft that has been now, which I showed just now, giving the details of the metrics, and have a core group which will go through this and assess where you stand. and make a list as what is to be done. What is to be done immediately, what can be done later, what can be done in future. And this is only to expect a better grade or level as per the new reforms. Make a team. Without a team, just now I was appreciating Dr. Pawan Kapoor when he said that yes, it is a teamwork. Single-handed, alone, you cannot achieve. It is always we, not I. So please see that all the entire team works towards that. And document verification or data provision, data given, please see to it that it is authentic data. No fudging of data, no fake, and the data should have, we are talking about quality. I always say breathe quality. So we must see that it is a quality document that has been produced, and a good IT setup is the one that helps you, because this is a system, it is data driven system. And all this, once you follow, sky is the limit. So you can continue going on. As just now he said, the journey of quality continues. It goes on and on. The limit is now, at the moment, we have to think of, we have to get set, we have to be ready to get set to embrace the new NAAC reforms. And then only it is possible to think that where we stand. I wish you all the best. I thank the organizers of King George Medical University, Lucknow, for giving me this opportunity. And I thank Dr. Anita, who was following up closely, because he said that I was just following it up, and then I thought I should log in, and that is the time she told me that it is my turn and my session rather. And I thank, I will be failing in my duty if I don't thank Dr. Punita Manik, who was chairing the session. Thank you very much. God bless you all.
Thank you, ma'am. Thank you so much for highlighting the recent changes in NAAC reforms. Ma'am, there is a question from one of the delegates who's attending your session online.
Yes.
The question is, if an institution has been accredited in 2023, which is valid till 2028, do we still need to go for binary accreditation now or after 2028?
We asked the same question because ours is 7 years. So ours was also till 27. And when we asked that time, they said that you can continue this till 27 if you want to, or you can apply for your, because we are already in that A++ grade. I'm talking about our Vidyapit. Otherwise, whatever is the grade, you can, that thing is that you can go ahead with binary accreditation. But still they said you can confirm, you can send a mail to NAAC and they will answer you, because every day it's a volatile stage at this juncture. The manual will be formulated, the manual will be there, and we will be all ready for the accreditation by December 2024. And if you ask her to be in touch with me, I can tell her that what is the best thing that they can do.
Okay, okay. Thank you so much, ma'am.
Thank you.
I wish you were here. Very much.
Thank you.
Thank you, ma'am. I'll request Dr. R.R. Singh, who's heading the Department of Medicine at Hind Medical College, to felicitate the chairperson, Dr. Punita Manik.